Hello everyone, this is Ola. In this video, I'll discuss briefly the head regional anatomy. So I'll go over the different muscles in the face, blood supply, and nerve supply. Let's start with the head muscles. There are two groups. The muscles of facial expressions, so responsible for smiling, frowning, different facial expression actions. And those muscles are getting their signal from the facial nerve, which is the seventh cranial nerve. The other group is the mastication muscles, and they are the ones to help to chew food. So they move the mandible. The mastication muscles are supplied with the mandibular branch of the trigeminal nerve. So from its name, tri, meaning the nerve that has three branches, its third branch goes to the mandibular region to supply the mastication muscles, which is V3. V is 5 in Latin, 3, it's the third branch of the trigeminal. Let's first begin with the facial expression muscles. There is a muscle that has two portions. It's occipitofrontalis. So it has a frontal belly and occipital belly. The frontal belly of occipitofrontalis, we call that also just frontalis muscle. The origin of the frontalis is from the epicranial aponeurosis. It's a flat sheet of dense regular connective tissue to attach the muscle to the bone of the skull. It's like a tendon, but it's rather flat and it's not cylindrical. Epicranial aponeurosis. And then the frontal belly goes to attach distally to the skin of the forehead and eyebrow. Remember, when a muscle moves, its distal attachment is the movable part. So the frontal belly moves the forehead and the eyebrow. It is a muscle that raises the eyebrow, responsible for the frowning action. The occipital belly of occipitofrontalis originates from the occipital bone, and then it is attached distally here to the epicranial aponeurosis. It is the muscle that retracts the scalp. And you know that some people are able to wiggle their ear. If you are able to do this action, it is the occipital belly of occipitofrontalis that is responsible for that. Then we have the orbicularis oculi. Orbicularis means circular. Oculi means eye. So it is a circular muscle around the eye. It originates from the frontal bone, but we care more about the insertion or the distal attachment because it's what helps us to conclude the action. It is attached distally to the lateral side of the eye. So it is the one that closes your eyelids, the one responsible for the winking and the blinking actions. So here, circular muscle around the eye, orbicularis oculi. Then we have another circular muscle, but around the mouth. So it is orbicularis oris. It originates from the skin around the mouth and it is attached distally to the lips. So it moves the lips. It is the muscle that protrudes the lips, responsible for the kissing action. So orbicularis oris muscle is the kissing muscle. Then we have the zygomaticus muscle. As its name indicates, it comes from the zygomatic bone, but distally it blends with the muscles at the corner of the mouth. So if you imagine the zygomaticus contracting, it causes the smiling action. So here is the zygomaticus muscle. It comes from the zygomatic bone, attaches distally to the corner of the mouth. It is the one responsible for the smiling action, zygomaticus. The buccinator muscle is a cheek muscle. It comes from the maxilla and the mandible, and distally it blends with the orbicularis oris muscle. The buccinator is the muscle that inflates and deflates the cheeks. So blowing a balloon, for example. So the buccinator is a muscle responsible for blowing a balloon, inflating the cheeks. So this muscle in pink, kind of deeper to the zygomaticus, is the buccinator muscle. The platysma muscle is a sheet of muscle uh, deeper to the skin of the neck. It originates from the lower neck, but distally it is attached to the skin of the cheeks and the mandible. It is the muscle that tenses the skin of the neck, leading to that dislike facial expression. So here is the platysma muscle, and it tenses the skin of the neck. Platysma muscle. Okay, this yellow here is the facial nerve. It comes from the narrow stylomastoid foramen, and then it gives branches going to the different facial expression muscles. Now, let's review the facial expression muscles action. So what is the muscle that raises the eyebrow and it is responsible for the frowning action? Of course, this muscle is the occipitofrontalis frontal belly, or we call it just frontalis muscle. How about the muscle responsible for smiling? This is the muscle from the zygomatic bone to the mouth corner, which is zygomaticus muscle. The muscle inflating the cheeks and blowing a balloon is buccinator muscle. The muscle that tenses the skin of the neck, leading to that dislike facial expression, is the platysma muscle. How about the muscle that winks and closes the eyelid? It is a circular muscle around the eye, orbicularis oculi. The kissing muscle is the circular muscle around the mouth, which is orbicularis oris muscle. Okay, now with the mastication muscles, we have four of them. The muscle that found here at the ramus of the mandible is the masseter muscle, and the masseter muscle elevates and protracts the mandible, meaning getting the mandible moving forward. We call it the prime mover of jaw closure because it is the most important and primary muscle that elevates the mandible when we eat. As you can see, all the mastication muscles are attached distally to the mandible because they move the mandible. This muscle here on the temporal bone, that is temporalis muscle, and this muscle also elevates the mandible, but it gets the mandible backward, which is retraction of the mandible. If you go one layer deeper, you will see other two deeper muscles. The muscle up here in yellow is the lateral pterygoid. Down we have the medial pterygoid. You may remember this by remembering that L in English comes before M. So the lateral pterygoid is above the medial pterygoid muscle. The medial pterygoid muscle elevates the mandible and moves your back teeth from one side to one side, which is the grinding action. So far we have three muscles closing or elevating the mandible: the masseter, temporalis, and medial pterygoid. The lateral pterygoid muscle is responsible for the protraction of the mandible and the grinding action when the food goes to the back teeth. So two muscles for the grinding action, they are the medial and lateral pterygoids. Three muscles for elevation, masseter, temporalis, and medial pterygoid. Which one is the prime mover of jaw closure? It is the masseter muscle. Okay, there are three things here, and they have a very nice relationship that is very easy to be remembered. So this thread here is the facial artery. Right behind the facial artery, this blue here is the facial vein. And then if you go behind the vein, you will see this, which is the parotid gland duct. So from anterior going posterior, we have the facial artery, then facial vein, then the parotid duct, AVD. The gland in front of the ear here is the parotid gland, which is the salivary gland producing saliva. The parotid gland duct courses over this muscle, which is the masseter, and then it enters the oral cavity through the buccinator muscle. So remember again that the parotid gland duct goes over the masseter and then pierces the buccinator muscle to drive the saliva to the oral cavity.